I have gone through the reports of Miss Jaina Ahmed, right? Your name is Jaina Ahmed? Jaina. So your shoulder is problem, right? Hello? Yeah, right shoulder is right shoulder. So by going through your report, this showing that there is some inflammation in the right shoulder, which muscles take your hand above hand, AC joint. There is some arthritis. So that was impinging on the muscle. So it is known as impingement, right? Yeah. So for how many, can I ask you something like how long you are suffering from this? Maybe months, weeks, or? Yeah. Right. So maybe your pain is when you're going up or coming down. When you raise your shoulder, raise your hand, then it gives a lot of pain, or while you are bringing your arm down, then you have pain. And what about the night sleep? Does it affect your night sleep, this pain? So your sleep becomes disturbed by this pain. And sometimes you wake up in the night, right? Okay, so any injection or something you have taken in your shoulder? Did you take any injection in the shoulder? That is known as subacromial decompression. This is the laser or arthroscopy surgery, where you clean the space and give the more room for the movement of the muscle or tendon. Okay? So keep on doing the physiotherapy. Don't stretch your hand above the shoulder, right? Otherwise it may become a complete tear of the tendon. So whenever feasible, come here, we will operate. And another report of your this wrist is there is a pressure on the median of that is known as carpal tunnel syndrome, right? So you must be having some numbness here, and different sense. Yeah, so this may also, if it is a persistent problem and not improving in the physio medicine, then this is also a small surgery which is known as a carpal tunnel release. It may require. And for your neck pain, you need to do a lot of physiotherapy because it's also saying that you have some cervical radiculopathy. So probably better to get the MRI of the cervical spine. So number one, the shoulder is complete right. Second, we are discussing about your wrist problem, hand problem. So there is some compression on the median nerve that is known as carpal tunnel syndrome. So it may require surgery. You understand? And he will pass on you. Okay? Yeah, anything you want to ask? Thanks. Take care, Jana. Okay. Okay, bye-bye. Have a nice day. Bye.